By the end of nursing school, I was a little discouraged. I thought maybe I couldn't be a good nurse.
And I went traveling. I realized that the other hospital was not constantly changing their practices. They were not constantly improving.
I started in the medical field as a paramedic and kind of reached a point where I wanted more time with my patients to really see them over the hump. University Hospital, I think, offers the perfect environment for that. If you want a learning environment, an environment where you can ask questions, an environment where you can keep families involved throughout the entire process, this is the place to work.
I did my practicum here on the 3rd floor, totally changed my view of nursing, and I walked away reassured that I could make a great nurse.
And when I returned to the Mobile area, USA was the only hospital that I wanted to work at, the only hospital that I applied at, because I knew that they were constantly changing, constantly evolving, and researching in order to give the best quality care to their patients.
As a new nurse, a big thing is to not feel intimidated in your workplace. And it's nice to be surrounded by more experienced nurses who are patient, who are there willing to accept your questions.
I started here as a patient care assistant in 1998 and have advanced my way to currently being an educator in the operating room.
I did work somewhere else in a completely different specialty, then I decided to come back. It just felt more natural to be back in my home.
University Hospital offers a completely different aspect to your professional experience.
The interdisciplinary aspect of things is really here and alive.
Physical therapy, pharmacy, we are all constantly talking to each other. We're discussing plans of care. You know, the nursing opinion is very respected here.
Nurses are encouraged to ask questions. We're encouraged to speak up and to advocate for our patients. I think that's one of the most effective things you can do as a nurse is to learn to advocate for your patient.
As a new nurse, it's very important to know that you won't be reprimanded for addressing patient needs to physicians or higher level providers. It's important to know that as a new nurse you have a voice, and here at University Hospital you are a part of the team.
You can ask management anything. Having to go roll a patient downstairs because they're being discharged, taking them to dialysis.
If our bedside nurses are super busy, because we are the only level 1 trauma center in the region, our patients are the sickest of the sick. Leadership is there putting on gloves, bathing patients, passing meds.
It's a real collaborative environment. And it's a great place to start, a great place to grow, and if they are wanting to further their education, you know, they can also go back to University of South Alabama and pursue those career goals.
I really do like working here. It's fun.